This is a quick, short video to show you how to take care of some mild orthodontic issues at home. If you can't get into the office for any reason and we can't see you, and you need to make yourself comfortable until we can get you in, let's look at a few situations here. The first I will show you, if there is a brace that is loose or broken and is moving around, it is not attached to the tooth anymore, you can usually leave it alone. It is important to fix the next time you come in, but if it is not something that you have to deal with right away. But if it is bothering you, the easiest thing to do is take a piece of wax and stick it on there. It will keep it from moving back and forth a lot and protect you from any edges that will irritate you. Now, if that broken brace is on the last tooth, this is where your cheap cuticle cutter or nail clipper comes into play. I recommend purchasing a new one for this or sterilizing before using. You can usually just cut the wire. Now, it is important to cut the wire as close to the next tooth that is still intact as possible. That will minimize how much wire you have sticking out. If we go in and cut this off, and I try to leave as little wire sticking out as possible, sometimes there will be a little piece of wire sticking out. Here's where you can take a piece of wax and stick it there until you can come in and we can keep you comfortable. Another thing to keep in mind, sometimes we would ask you to wear a rubber band from that very last tooth connecting from top to bottom. If you are using that brace to hold that rubber band, if you can't wear it on one side, don't wear it on the other side and stop altogether. Another thing we have, sometimes a steel tie will poke out. Usually the rubber bands go around each tooth and often colored for kids that want colors. Sometimes we'll put a steel tie instead. Sometimes where we twist it tight, it will stick out. If that gets pulled out of place, it will irritate your cheek. You can use an eraser end of a pencil to tuck it up and underneath so it doesn't poke you. You can also put some of our patient wax that everyone gets when they come to the office. Lastly, some of the braces have posts or extensions for the ability to wear rubber bands from, and depending on the position of the teeth, especially in the beginning of treatment, they may irritate your cheeks. Please use the wax on these hooks and let us know at your next appointment so we can adjust these posts. That will get you through most of the little things that can happen and you can't get into the office. Hope that helps, and we look forward to seeing you in the office soon.